welcome back. This is NewsFile, it's your most authoritative news analysis platform. Right here in the studio presently is Yao D. Opong. He's lawyer and member of the Akufo-Addo's legal team in the Supreme Court over the election petition. Thank you, Yao, for making the time to join us.
Thank you very much.
Yes,
good to be here.
This show has missed you.
Can imagine, yes.
Right. So as you can recall, Yao was almost like a regular on this show some time back. He's a very good friend of mine. We would also have the opportunity of being joined by Dr. Dominic Ayine, MP Bolga East, and member of the legal team of John Mahama. My friends Martin Pebu, Dennis J. Jumo will all join us to look at what happened in the Supreme Court. But we must be alive to fight election petitions and to seek power to rule the country. So let's check whether or not COVID is not dealing a blow on us. Joining us first is Reverend Professor Seth Aite, Professor Emeritus of the University of Ghana and retired Presbyterian minister. We'll be joined by Kwame Sapong-Esiedu, pharmacist and fellow, Ghana Center for Democratic Development, CDD Ghana, and Dr. Bernard Tobo, who is consultant urologist, Kolebu Teaching Hospital. So let's start with Reverend Professor Aite. Thank you very much for joining us. Hello.
Thank you.
Great. So that was Yao Sapong, Kwame Sapong-Esiedu, correct? Hello, Reverend Professor Aite. Okay, I suppose we appear to have lost him there. We'll raise him back immediately. Now, okay, Dr. Bernard Tobo, thank you also for joining us.
Thank you very much indeed, Samson.
Great. Your lines are very clean. Now, Kwame, very briefly, where are we as a country? We know that the death toll is rising. I'll show you some of the numbers shortly. But the frightening news coming up from Kofa Anochi, for example, about as many as 9, kids, getting, infected. And then there was a testing they did for a number of patients. And out of that, almost 50% tested positive for COVID. Where are we?
Basically, I'd sum it and say we are at a point where personal responsibility has become key. We are at a point where the numbers are such that if we don't take our security into our own hands by way of living with the safety protocols, the numbers are going to overrun the system. We're at a point where the mortalities are going high and infection rates are spreading quickly. We're at a point where our reproductive number is above 1.5 now. Our doubling rate, that is the number of days it takes for active cases to double, is 6.5 days and dropping. It was 9 days only last Wednesday. So we're at a point where all our pandemic parameters don't look great. And we are being told by our health practitioners that our health systems are getting full as well. And we know, because I've appeared on other programs with some doctors who tell us that we're at a point where people are even testing positive and are struggling to find beds when even they are struggling with the quality of care. So it's not a great picture, but I also think we're at a point where we can turn things around if we put our heads to it.
All right. Dr. Bernard Tobo, you're a consultant urologist, Kolebu Teaching Hospital. In the past 2-3 weeks, when you are entering the hospital to get into your office, how does it look like? I have seen some scenes there. I don't know how to interpret them.
Good morning once again, and good morning to our cherished listeners and viewers. I must say, working in Kolebu Teaching Hospital around this time is quite frightful. It's quite frightful. I mean, we have increased numbers. There are patients, mostly poor patients, who don't have any other place to go to in terms of healthcare. I mean, when the lockdown happened, people started, seeking alternative healthcare. But those people end up developing complications, and at the end of the day, the buck stops at Kolebu Teaching Hospital. And you still continue to have increased numbers. And the question you ask yourself, can you turn them away? Because if you decide to focus your attention on COVID-19, other non-communicable diseases of, let's say, equal importance will rear their ugly head and will be in for a disaster. It's not a nice situation.
Okay, interesting. So I've come over the place about 2-3 times, and I just drive in and observe, the near no parking space, and the cars parking on the road, on the edges, and then you see patients or visitors sitting under trees and being attended to. That's what I said I couldn't interpret.
Even the cars are not observing social distance. And our consulting rooms, I must say, are not the most friendly when it comes to patient privacy, and even around this critical time when we have a pandemic. So it is more or less like a stopgap situation, solution. You can't keep people bottled up within a small confinement of space. So the best thing within our constraints is to let some patients sit outside, at least having some fresh air with some amount of social distancing. And I think everybody is waiting for this pandemic to, settle down or go away.
Now, as a urologist, how have you been processing the news about potential effects, as in matters of erectile dysfunction arising from COVID? What should we do with that kind of news? Is it just intentional so that to get all men to become very, active to observe the protocols and to protect themselves from being infected?
Something, the news about erectile dysfunction, with regard to COVID-19, it's not funny. Leo Tolstoy, I'm sure you've heard about him, once talked about erectile dysfunction being the tragedy of the bedroom, and that there is no tragedy that surpasses, that of erectile dysfunction. And he sums it very, very well and aptly. This is a silent epidemic which is developing post-COVID. The thing about us, most people don't report erectile dysfunction unless they are pushed to the wall. But it is a veritable, it is something, we don't have it all in terms of the knowledge, but it's something that is coming out, particularly in jurisdictions where they have increased numbers, and so they're able to study the trends very well. What we have is just anecdotal, evidence, but suffice it to say that we're going to have issues with our erectile functions.
I'll return to you to ask what we should do then. Of course, generally, what all people should be doing, but specifically, what we should do to avoid this. I have Reverend Professor Seth Aite back. He is Emeritus Professor of the University of Ghana and a retired Presbyterian minister. Thank you very much for joining us, Reverend Professor Seth Aite.
Thank you very much, and good morning to your cherished viewers.
Great, thank you. Now, I'd like you to talk to us briefly about this COVID situation and how you think the country can better handle it. And then we will zoom in on the question of the hydrogen peroxide, which has attracted a lot of discussion because of what you have had to say about it.
Yes, well, thank you very much again for inviting me. In relation to government policy, I wouldn't be in a position to comment on that, because government has advisors who I believe are doing their job. My focus really is on hydrogen peroxide, and I can say from what we have researched, what we have found, the evidence we have so far clearly indicates that hydrogen peroxide works. And I'm emphasizing hydrogen peroxide works. And this is where our focus should be, in addition to all the protocols that are already in place. As most of you will know, hydrogen peroxide is a chemical that has been used over the years. Our great-grandfathers use it, our grandfathers use it, we are using it, our children are using it. Can you hear me?
Yes, I can hear you very clearly.
Can you? Yes, okay, yes. And it is used by some for hygienic purposes, cleaning of wounds, cleaning of the mouth, and so on. Others use it as a bleach, but we are using it as a solution that provides good quality oral hygiene. Now, it has been shown very clearly, and the literature is there for all who are interested to search, very clearly that hydrogen peroxide, in addition to inactivating bacteria and fungi, also inactivates viruses. In fact, it has been shown that it inactivates all the respiratory viruses that we've come across so far. The MERS virus, Middle East Respiratory Syndrome, H1N1, and then the first SARS virus. And it certainly has also been shown to inactivate the current virus. And 1% hydrogen peroxide is enough. Use over 1 minute inactivates the virus. And even 0.5% on surfaces can inactivate the virus. So we've applied this principle. And let me also say that even in the measures that are taken before the virus enters our oral cavity and nasal cavity to cause infection, even those measures contain the use of alcohol and
we're losing prosperity there. If you can have your line, I don't know what exactly to say really, because it's clearly not your making, it's the internet. Right. Hello, prosperity. Okay, so let's.
Yes, can you hear me now?
Yes, I can hear you. Now, I have interacted with some doctors, and a good number of them, they have so much regard for you, and they say, for once, they are concerned. You have pioneered things or said things that they are all proud of, but on this occasion, they are concerned about this particular matter of hydrogen peroxide. And for how long will anybody have to use it? And even how to measure, the acceptable level of diluting it and all. Are you not concerned yourself that there may be a problem? Because as I hear, you may not have to use it for too long, for a certain period, maybe not more than 3 months. What do you say? Hello, Prof. Can you hear me? Hello, Prof. Unmute. If you unmute your microphone.
Yes, can you hear me now?
Yes, are you back? Okay, the line is not the best. Let's try it again. But the question I just put to him, Kwame and Bernard, you can begin to give us an idea where you also stand on this H2O2. Yeah, so Kwame, let's start with you. Briefly, do you have any concerns about it? What should we be doing? And we are hearing reports of shortage already in the market.
Thank you, Samson. I am somebody who always goes to primary research. If there's anything COVID has taught me, it has taught me the fact that a lot of the scientific body of evidence evolves. And what do I mean by that? When it started, we were all told about the fact that it wasn't even, an airborne infection, or it wasn't transmitted by air. I remember coming on this program and you putting that question to me at that time, and I did tell you that based on the primary research, which hadn't been peer-reviewed at the time, there was a lot of evidence evolving that it was an airborne respiratory infection, and that the use of the face mask could be precautionary, but I was not prepared for us to wait until the evidence had gone through peer review, systematic review. Then the WHO had turned it into policy and we accepted. So when I heard what Professor Ite had published, I decided to do the same thing I did with the face masks. I decided to go to the primary research. And to the primary research, I looked for 3 journals. I looked for the British Medical Journal, I looked for Nature, and I looked for Science, because I can't go wrong from there. And then I looked at what's called the MedRx, where a lot of the research that hasn't been published yet is put there prior to peer review. The honest truth is there's a lot of body of evidence about hydrogen peroxide being used against SARS-CoV-2. But at the end of it, the British Medical Journal and Nature, for example, say that there isn't enough evidence at the moment to conclude. Now, here's the thing. Those 2 same journals said the same thing about face masks. And that is where I situated, because when such reputable journals are not able to stick their necks out and say, this doesn't work, I sit back and say, let's err on the side of caution here and let the body of scientific evidence evolve. A similar thing was what my colleague, the urologist, was saying about this erectile dysfunction and oligospermia and other things that's happening with COVID. Initially, it was anecdotal. It started appearing, they said, there's not enough body of evidence. Now we know it's real. So much as I know that dilution from a pharmaceutical chemistry standpoint of hydrogen peroxide could be a challenge for a lot of people, and I am concerned that people are buying it in drones and it has run out, I wouldn't want, from a scientific standpoint, to dismiss it entirely and say, this doesn't add up. Because if you look at the science, is hydrogen peroxide 1.5% or 1% virucidal? Yes, it is. Is it virostatic? Yes, it is. Is that theory? Yes, it's pharmaceutical chemistry and medicinal chemistry theory. Then I look at, is the theory scientifically based? Yes, it is. Is there evidence in practice? Now, yes, it is. And I've given people the source of the evidence I'm talking about. And I'm talking about 3 of the world's most reputable scientific journals. Have they been able to make a definitive stand on hydrogen peroxide? No, they haven't. But they haven't also discounted it as well. And I situate it here because if you look at drugs like chloroquine and the others, these journals at a point were able to make a categorical statement and say, this doesn't work. They haven't made it in this case. And they are waiting for the peer review and more research to go on. So I would say that we need to also carry cautiously and not just discredit it and say that we are concerned. Yes, there are concerns about the dilution and all that, but at this point, I would just not wash my hands off it.
Right. Dr. Benato, what do you say about it also? I have been educated to know that, hydrogen peroxide is used, you doctors, particularly those of you doing surgeries, you use it so frequently, but when it has to be used in the manner that we are being advised, which Kwame says we should be cautious about and not dismiss, I'm being told that there's a certain time limit also. And even the question of the mixture, the proper quantity that you need to put in and mix with the water and everything, if we are not careful, we'll rather through this send people to their early graves.
Yes, Simpson, I side with what Kwame is saying. We can't throw the baby with the bathwater. I mean, even though the body of evidence out there is quite scanty and the information is still evolving, I mean, with regard to the COVID-19 narrative, suffice it to say, the hydrogen peroxide has been used, I mean, prior to the insurgence of COVID. I mean, you can use it very, very well in safe dilutions when it comes to even as a mouthwash or for other oral or nasopharynx situations. The challenge here, I think the information should go out, the education should go out there, because as you have alluded to, the shelves are empty. And this is the time that people are going to, make small money or big money for that matter. People will change their businesses to go and sell hydrogen peroxide. And FDA or Food and Drugs Board will have to really open their eyes, very well. The education should go out there. People shouldn't think that hydrogen peroxide is the overall panacea. We still have to observe the protocols. We still have to, social distance, hand washing, face masking. We still have to do all that. But I must say, like Mr. Asiedu rightly pointed out, even though the body of evidence is scanty, sometimes you don't have to wait till you get everything. Sometimes by deduction, sometimes by intuition, you may draw your conclusions, and then provided that the education has gone out there and people are doing it right in the right dilutions, that is what has to be hammered on. So the direction of hydrogen peroxide, I think we should explore it as the venerable professor is championing.
But are you any concerned that we are running out of stock on the market already?
Very, very concerned.
Okay.
Like I pointed out, people will start businesses very soon. Hydrogen peroxide in various imitations or what have you will appear. And there's a time that, some unscrupulous people will make big, big money. So FDA will have to open their eyes seriously.
Okay.
I may change my job probably to go into hydrogen peroxide business.
Anyway, now, Professor Isaac, thank you very much for getting back.
I'm back.
Right. Too bad how the internet at your end is behaving. But I was asking what you have to say about concerns raised by doctors, particularly those who are involved in surgery and other things who use hydrogen peroxide very often, and who say there ought to be a lot of caution in preaching, the use of, H2O2.
Yes. Okay, thank you very much. Let me say that we started investigation into hydrogen peroxide as far back as March last year. And we've waited for evidence up to now that we have escalation in the number of cases. And we think that the observations we have made so far are quite relevant for us to come into the public domain. I heard the previous speaker referring to British Medical Journal. Indeed, we published our first paper in the British Medical Journal, July 2020, and that is that is cited in the public statement that we made. If you read that, you will get quite a bit of references about hydrogen peroxide and its effect on viruses, especially respiratory viruses, including the influenza virus. What we all just needed to do was to begin to use it ourselves. Those in the team, members of our family, our friends, and so on, to see whether really it will be helpful. And one key evidence we have, and we cited it in the public statement we issued, is that 8 nurses, frontline nurses, who are working at the Dodowa District Hospital and who just use face masks and wear scrubs and gloves to manage, first of all, receive COVID-19 patients and to manage them. 8 of them have remained negative and they've been well. They haven't had COVID over the period of 9 months. Whereas those 62 of their colleagues who are not using hydrogen peroxide have had COVID. In fact, I'm at an engagement ceremony now. And as it turned, the gentleman I sat next to works with the National Health Insurance Authority. And he made a startling statement to me. He said someone introduced it to him in June last year. And he has used hydrogen peroxide regularly. And sometimes at the office, he forgets even to use the mask. But it turned out that his colleagues became infected. And he alone tested negative. You know, when you have observational evidences like this, you don't throw them out.
Right. And now, Prof.
These are not just the only two. There are several.
Now, Prof, what is... Prof, what is your reaction to the concern that you cannot use this? Of course, it's for preventative use purposes, that you gargle it. I'm told that after a certain period, it might affect your teeth, and you cannot use it for so long. Is that the case? And how long, if that is the case, can one be using hydrogen peroxide?
Very good statement you made. You know, one of my colleagues made a statement, one of my international colleagues made a statement that if the whole world should use hydrogen peroxide for a week or 2 without break, we would make a significant progress in managing and getting rid of COVID. So if we eliminate it, and what I would suggest is that we look for the hot zones. We look for the hot zones where the disease is spreading and intervene with hydrogen peroxide, find out whether it works or not. And if we mop it up, we will not need to continue to use hydrogen peroxide for a year or whatever. No. And the concentrations we are using, 1%, is very, very low. It's not the concentration that you use for bleaching, which is 20 to 30%, in the 20 to 30% range.
So there's a science about...
What we are also saying is that even when someone has COVID, yes, and the way hydrogen peroxide works is that it breaks down into water and free oxygen molecules, which are radical oxygen species. And these species would attack the membrane wall of the virus. So whilst it's in the oral cavity and nasal cavity, the oxygen molecules or radical oxygen species will destroy the membrane wall and therefore make it impossible for the virus to attach to the surface, that is the mucosa, to penetrate further. If it penetrates, then you lose the opportunity to inactivate the virus. But when the patient now has COVID, the viruses must leave to now infect others. And when they live in, they use the same routes, the oral cavity and the nasal cavity. What we are suggesting is that if someone has COVID, let the person use hydrogen peroxide. And when he or she uses hydrogen peroxide, the viruses he or she will be shedding will be inactivated virus. So they will not be able to infect their contacts, and particularly healthcare workers. So our emphasis should be on protecting healthcare workers aside all the protocols that have been accepted to use hydrogen peroxide so we can break the chain.
Well, much earlier on, one of your colleagues, also an emeritus professor in this area, spoke to me personally, privately about this and recommended that I tried it myself and with my family. But question is, how is it supposed to be used? Can you demonstrate practically how it is supposed to be used? And in any situation, for how long? If you are going to use it daily, how do you use it? And for how long can you not continue to use it?
Yes, well, for health workers who are in a critical area, and who have a greater risk of being infected, I would say they can use it twice a day or at least every evening, because again we looked at the size of all this. The virus for a little time gets itself ready to. So we have 2 to 3 days after the virus has 2 to 3 days, and then we can get rid of the virus then. So those who are at risk, they should use it every evening at least. Yes, and I would say that those who are at risk, the older people from 65 years onwards, they can also use it daily. What we tell our friends is that anytime they feel exposed, that is after being in a crowded area, whether at church or in the market or funerals or any social event, when they get home in the evening, they should use it. And you don't have to use it daily. But as I'm saying, if we have a national policy and we use it based on the evidence, based on the science, based on the evidence, and so on, we can get rid of this scourge on the whole world in a very relatively short time.
Yes. So finally, in some 30 seconds, how is it supposed to be used? How?
Yes. In fact, we've done a little leaflet, which we posted. I'll send a copy to you. But what you do is that you take 1 part of hydrogen peroxide and add 5 parts of water to it. But most of the hydrogen peroxide on the market is 6%. So if you take 1 part of that and add 5 parts of water to it, you get 1%. And you gargle this for 1 minute and spit out. Then the 1% you prepared, you take 1 part of it and add 1 part of water. That gives you 0.5%. And the 0.5% you can use for nasal wash. But we would like the pharmaceutical industries to start thinking about producing a spray, nasal spray and oropharyngeal spray. Once that is done, you wouldn't need to use the fluid directly. So you can spray it into your nose every evening, you can spray it into your mouth every evening, depending on the concentrations, 0.5 for the nose and 1% for the oral and throat cavities.
Thank you very much, Reverend Professor Aite, for joining us to explain your point about hydrogen peroxide. Let me go and end with Kwame and Bernard. Now, Kwame, listening to him and Bernard, both of you, if I'm listening to Prof now and I have no idea how to do the measurements he's talking about, how to measure the water and to do the mixture or dilution, how can you assist so that the concern and the danger you preach against may be avoided?
Samson, thanks. I'm a pharmaceutical chemist by trade, so that is where my concerns come from, that when I tell someone to do a 1 in 4, 1 in 5 dilution, even when I was a lecturer in the university, in the lecture hall, students struggled with it. They struggled with serial dilution. It's one of the struggles of pharmaceutical chemistry, even when I used to teach it. So I agree with Prof. Ayute that the best bet would be for, if this is a route that people are going to go by, for the dilution maybe to be done on people's behalf rather than people doing it themselves. Because the thing about hydrogen peroxide is it's corrosive as well. So if you don't get the dilutions right, you might end up corroding the oral mucosa of your mouth and your nose. But when I sit with these cautions, so basically, let me put it, if you have a measuring cylinder at home and you're going to do this, if you take even 10 ml, you've got to add 50 ml of water, and that would give you roughly the 1%. That I'm using roughly because it's not as accurate, but that would put you in the ballpark figure of 1%. But you see, when I hear scientific debates like this going on, it takes me back to the end of the 19th, 20th century when what's called puerperal fever was in vogue globally, and people were dying at birth because doctors were not sanitizing their hands after they had gone into the morgue to do autopsies and then come into the delivery suites to actually deliver babies, and they were transmitting infection, and babies were dying and mothers were dying. It took one doctor who then said that let's try and wash our hands with bleach when we're leaving, and suddenly puerperal fever was history. But when he did that, what happened, Samson? He was sent to a psychiatric institute because his colleagues felt it was sacrilege to think that they were the filthy ones who were transmitting the infection to their patients. And this is medical history. Ignatius Semmelweis, it's written medical history. There's the same thing with leukemia, with J.A. Farrar, who is the father of leukemia and has led us to this point where leukemia is a disease that is treatable. When he started with vincristine and other things in the United Kingdom, in the United States, they nearly struck him off the register. So I am saying this thing because I am not surprised when someone says something that is a bit altruistic in medicine, and the general medical fraternity develop cold feet.
Right.
Because if you're like me who reads medical history, it transcends medical history even up to this day. As I talk now, there's a doctor who is the father of technology in medicine, who is saying that the stethoscope should be shunted and they should use handheld ultrasounds. The same thing is happening to him. You can go and look for his book, Deep Medicine, and read as well. So in healthcare, these things happen because we are not very used to radical change.
Right.
We're used to the status quo and tweaking.
Right. Kwame, in a minute or two, what do you have to say about the new preaching to double the mask? And that's the surest way, doubling the mask.
Yeah, the thing I would say is that the data coming out means that these new variants have evolved to be much, much smaller than what came from Wuhan. And so some are thinking they are penetrating the mask, and that is why when certain people are wearing the mask and doing everything, they are still getting infected. The truth of the matter is doubling the mask is an issue when you are not using the right set of masks. But with the surgical mask and the other sets of masks, you can do that. But if you use it properly, you still are safe. The concern I would have would be with the handmade masks, and probably the fact that even with the handmade mask, if you are using the one from FDA where the technology has been applied properly, I wouldn't be too concerned. But to be sure, doubly sure, with the way the variants are going, I've just put out something from the African CDC, which is saying the variants are all over the place, including Ghana. You need to be very cautious. Wash your hands. If you have to double the mask, double it. But most importantly, wear the mask at all times.
Right. Do you have any expectations if the president, hopefully, is it tomorrow or Sunday, wants to make a broadcast, what at least 2 major things would you expect? There are some who suggest that we should get back to shutting schools, not going to church and all that.
You see, Samson, I've always said when the schools reopen that we cannot keep our children away from school forever. But I also acknowledge that when you open schools, you increase mobility. And like it's always been said, you move, this virus moves. When we were kids, there was a game called Stay. That's what the virus is playing with us. If you say stay and you stand there, you're safe. But if you move, you put yourself at risk. So I would want that the president would try and cut down on mobility. Even if the children are still going to go to school, we need to look at mobility around churches, funerals, and all those things. We need to look at the number of people who go to these facilities, mosques, and all those things. That is one thing that I think we need to look at because we need to decrease the human interaction. The other thing I would want to look at is restrictions around the number of people who are going into our public transport. Because at the time when the easing of the restrictions on public transports were made, it was said that because of the air and the ventilation in most of the trottoirs, because the windows
from day one,
the chances are lower. The reality of the matter is with these new variants, they are 50 to 70% more contagious. So that makes proximity a very, very important issue. The closer you are to people, the more likely this will deposit on the oral or nasal mucosa, and then you might get infected. So those are the 2 things I would want to be looked at. Mobility across the country, non-essential mobility. When I say non-essential, some people say, but for me, church is essential. But when you're dealing with a pandemic, essential is the things that directly impact on our economy, our labor force, etc. And I think education is one of them.
All right.
So those are the 2 things I'd want to see.
Thank you very much, Kwame Sapong-Siedu, for always coming through and assisting our country with your knowledge and expertise on how to navigate this COVID situation. Now, Bernard, I'll finish up with you. If you have anything to say about the hydrogen peroxide, let's hear that comment. Then I'll ask you a couple of questions, and then you conclude also on the, if you like, the urological question, the erectile dysfunction, because we didn't finish on it.
Yes, quickly on the hydrogen peroxide, I hold a view that it shouldn't be a crusade championed by the venerable professor alone. We should have other agencies, the Ministry of Health, the Ghana Health Service, even GMA. We should all act in concert to, look more into it and to bring out a specific protocol and then educate our public. I stand for the view of us having, already diluted preparations on the market instead of leaving people to do their own dilutions. Because, look, if somebody has an itch in the throat, he takes 1 in 10 dilution and it's not going. He's going to double it. I mean, that is the problem with, people taking alternative medications or herbal medication. They multiply the amount they take in, and then with its attendant side effects. So I think we should look at it critically. Let's all work in concert, the pharmaceutical industries, so that we can bring out well-diluted products in the market.
Have you also known about it all this while, and have you been on it? As I said earlier, I was told about it quite long ago. It was a whisper to me privately.
I actually use it as a mouthwash regularly.
Okay.
Some of my family members usually have this tonsillitis or throat issues before even COVID. So for us, we've been using it as a gargle, and it worked. But like I said, we still need a body of evidence. We still need to gather data.
Yeah. Now, knowing the statistics as far as COVID is concerned in this country, what will be your expectations when the president speaks? We have seen the Ghana Medical Association now being very much upfront and being blunt and telling us what has to be done. Your colleagues at Komfo Anokye Hospital, particularly led by Dr. Pakwesi Bedu, very blunt about the issues and the cautions that we have to take and everything. What will you expect the president to be doing?
Well, if we want to look at all the figures that are, coming out, the most plausible or knee-jerk reaction will be another lockdown. But you need to situate it very well. I mean, the social impact, economical impact here and there. So I wouldn't, ask for a lockdown per se, but maybe a more tighter restriction. Let's crack the whip. When the president announces whatever and empowers the police, what have you, within the first few days, you see them, with so much zeal acting, then everything fizzles out. Mm-hmm. Let's sustain the punitive measures. Let's sustain it. Let's push it and let education still continue. Let's, observe the protocols. I wouldn't call for a lockdown per se, but to enforce the rules very well.
All right. So we understand that the issue of erectile dysfunction effects of COVID, though rare, may not be worse. And we actually are hearing also of COVID-related psychosis. And we understand there are some people actually under observation now. So tell us what to know about the question of erectile dysfunction, and if you know anything about this COVID-related psychosis.
Initially, COVID was thought to be purely respiratory. And then the body of knowledge started increasing, and now we know that it is multi-systemic. It affects virtually every system, and the erectile function is no exception. As a matter of fact, when you look at erection, it is an interplay between three different systems. The cardiovascular, made up of the heart, the blood vessels, that's one. And then two, the neurological, made up of the brain and the nerves. And then the hormones, of which the headquarters of production of testosterone is the testes. And COVID has been found from the body of knowledge we have now to, if I take the cardiovascular, the blood vessels tend to be narrowed by clot formation, what we call microthrombi. Not only that, the inner lining of the blood vessels also gets affected, and it affects its ability to relax, for blood to flow through, to have a firm erection. The heart by itself is affected by the inflammation, and its pumping activity, it's deregulated. So all these things act in concert. The neurological, of which the brain is the chief center. In fact, psychologists refer to the brain as a primary sex organ. What you have down there is just a representation of everything upstairs. So if the brain goes whack, and looking at what COVID is bringing, people are likening it to what we call a post-traumatic stress disorder. Conditions akin to what happened post 9/11 or any major disaster like earthquakes and what have you. And the body of knowledge is still increasing. A whole host of neurological brain disorders, from psychosis, delirium, anxiety, depression. Once the work of the brain is affected, the brain has to trigger desire before the electrical activity in the nerves are triggered, and then the blood vessels respond, what have you. So once the brain is affected, then it can impact negatively on the erection. Coming to the testes, the virus-based inflammation has been found to depress the production of testosterone, and not only that, even sperm production. And that also impacts negatively on erectile function.
All right.
So you have these three systems acting in concert. The last thing I'd like to say You see, the erectile dysfunction being brought up by COVID may be a surrogate marker or a pointer to an already existing problem with your health altogether. For instance, it's been found that people who have erectile dysfunction actually might have had, problems with their blood vessels or even with the heart, which might predate even 3 years, 5 years, 10 years. So COVID is just bringing out what is already simmering downstairs.
All right.
So,
okay.
Yeah.
Thank you so very much. Dr. Bernard Tobo is consultant urologist, Kolebu Teaching Hospital. Thank you all so very much. Now, there was one thing that ran through every expression or statement that even Prosaite himself, who is said to be the lead preacher of this hydrogen peroxide, and also Dr. Bernard Tobo, as well as Kwame Sapon Asiedu, you heard them. The caution must be observed. Already we understand that we're running out of stock of 82802 in the market, on the market, and that's not a good sign at all. For them, their preference will be that the thing, is finalized at the pharmaceutical end, even if it has to be recommended so much for use, so that, otherwise there are problems. And I needed to let you understand that as well. And remember, there are many doctors like them who disagree, who at this point say this is not the way to go, not at all. Right, we will take a quick break, return to the Supreme Court. But remember, this show is brought to you by Bank of Africa, as strong as a group and close as a partner. MTN, everywhere you go. Ashesi University, educating ethical and entrepreneurial leaders for Africa. Duraflas, where Duraflas goes, water flows. Having mosquito spray and coil. Pleasant on humans, tough nightmare on insects. And Napa Foods, it's tasty. DBS Industries. Robert & Sons Limited, Optical Services, your comprehensive eye service provider. We'll be right back, getting into the Supreme Court.